We'll be starting the recording now. Thank you, Kaya. And we're going to go ahead and begin our presentation with Sutter Yuba Behavioral Health. They're going to be going over their services. And we are going to be starting with Dr. Mark Slutsmeyer. And I do have it set up that you can share your screen. So whenever you're ready, go ahead and do your thing, Mr. Slutsmeyer.
All right, my computer did not want to unmute. Can everybody hear me okay? Yeah, okay.
Yes.
All right, so good afternoon. I'm Mark Slutsmeyer. I'm the branch director for adult services for Sutter County. Just so I guess sort of by way of a little bit of background. So I started out as a therapist about 15 years ago with Sutter Yuba Behavioral Health, and then became a supervisor and program manager, and now I'm in the branch director role. So I have some background with Sutter Yuba Behavioral Health and our intake process and our access, but I've been more in administrative shoes for the last few years. So I've actually invited Lisa Jones, who you'll see has joined the call. She's what we call our healthcare access coordinator for adult services. And she's kind of what I would consider to be our probably most boots on the ground kind of person as far as access to behavioral health services in the community. So I've kind of called on her yesterday to sort of be my backup for today to kind of help with answering any questions that you all might have about accessing services in the community. I'm going to speak for a little while about adult services, and then I think later after I'm done, I'll be turning it over to Darren and Josh, and they'll be talking a little bit about youth services, so services for youth and families. So I do have a PowerPoint presentation. So you said I could share the screen. Is that right, Liz?
Yes.
I'm going to go ahead and do that right now. Hopefully, if I'm lucky. Can everybody see me? Can everybody see that? All right, awesome. It's a miracle. Okay, so I'm going to talk about accessing behavioral health services in the community. Let me get my control screen up. Here we go. All right. So to begin with, I just want to say that so understanding how behavioral health services are accessed starts with understanding how behavioral health services are paid for, because as many of you have probably experienced, behavioral health, finding a provider in the area can be a little bit confusing, and it's a little frustrating because it partly depends on who your insurance provider is. So I'm going to start by talking, I'm going to go through each of these in a little bit more detail, but basically the different options are you have some folks that have no insurance whatsoever. They're going to probably need to use either self-pay or no cost and low cost options in the area. So I'm going to talk a little bit about that. Then you have some folks that have private insurance, and typically folks with private insurance are seeing somebody in their private insurance network. Then we have folks that have Medicare, who they provide some general mental health services, but not a lot of specialty care. And then you have folks who have Medicare, or I'm sorry, Medi-Cal, and Medi-Cal has what we call a split benefit system. And the split benefit system kind of splits people into two different categories. You have folks who are mild to moderate, and then you have folks who are more in the chronic and severe range. And we'll talk a little bit about what that means, what that split benefit means, and how that how you want to kind of think about that as you're referring people and trying to help them get services, because there's a lot of confusion and frustration around split benefit. And even for us internally, it gets frustrating at times. So now I'll caveat all of this by saying, of course, when you're talking to somebody that's dealing with a chronic or even a mild behavioral health condition, sometimes the thought of even picking up the telephone to make a phone call can be overwhelming, right, to begin with. So add on top of that all these layers of complexity to, these different types of services that are available and how to seek them out. It can be very frustrating and confusing for them. So all of you I know are working in capacities and roles as helpers. So the more you can do to kind of help educate the people that you're working with and trying to connect to services, the better. I'm going to post this. I will put this PowerPoint presentation in the chat box. I put a couple flyers already in the chat box. I will put all the other stuff I'm referring to in this presentation that will be in the chat box as well, so that everybody can access it. You can print this PowerPoint presentation out if you want and have it on hand to give to people or share with people. You can email it to anybody you want. There's no copyright infringement issues or anything. So it's all good. I'll start by talking about no insurance. So if you're talking to somebody in the community that has no insurance whatsoever, a good starting place for them is low cost, no cost services. There are several clinics and places that won't turn you away if you don't have insurance. So Sutter Yuba Behavioral Health is one of those. All the FQHCs in the area are included in that. So Harmony Health, Ampla Health, Peachtree, they can't turn you away for not having insurance. They will encourage you to get insurance and they will work with you on the process of getting insurance, but they can't necessarily turn you away. I'm going to talk about some warm line support services. So there's a couple of different warm lines. Actually, I'm just going to go through this whole thing and then show you. So one of the warm lines that's available is California has a Pure Run warm line, which is a toll-free number. Anybody at any time, whether they're already receiving services, whether they have insurance or not, can call this 24-hour Pure Run warm line number. So this is a flyer we give out on a regular basis. I'll put this in the chat so that you can share it with people, print out copies of it if you want, have them right by your desk. This is a great resource. It's 24/7, no strings or anything like that. There's also, I'm going to share with you this. This flyer is for, these are free telehealth sessions. So you can get up to 12 individual sessions of telehealth for free from USC. This is a program that USC offers. So this is another one, no strings, no questions, anybody, you could call up today and say, hey, I'd like my 12 free sessions of therapy. Can I get them, please? So this is a great resource also. I'm putting this flyer also in the chat so that you can have, so that folks can have it. These are great resources to give people who may not be connected yet and they're wanting to get connected. I did call this number actually today to find out what their wait time is, and it's about 2 months. So just so you know, this one isn't an instant one, but so there's a little bit of a wait there, but it is free and there's no insurance requirement. Let me go backwards now, actually. Where were we? Okay, there we go. So we talked about warm line support. There's another warm line here. This is the CalHope website. And actually, if you go to their website, I didn't put any flyers on here because they actually have several. This is a great resource. This just started with COVID-19, this website, but they have lots of free resources for mental health support. They have warm line numbers on there. They have red line numbers on there. They have lots of different resources. So I would just encourage you to go to their website and look at the different resources that they have and share this link with folks who are maybe struggling. There's the nice thing about the CalHope website is they have different supports for different specialty populations. So like when you go to their website and you look at their current services, you can click on African-American, Latinx, LGBT, all these different like sort of subgroups of folks that may want specialized help or treatment or support. And so that's a really nice, again, free resource. I talked about telehealth counseling through USC. That was the flyer I shared. If you go to any of the federally qualified healthcare centers, as I mentioned, Peachtree, Ampla, or Harmony, they provide services to the indigent population, and also Sutter Yuba Behavioral Health does. But we, like I said, all of these clinics, they will, because we do depend on Medi-Cal for our income for services, we do work with people to get signed up for insurance. I'm going to stop for a second. Does anybody have any questions about anything I've shared so far? All right, we're good.
All right.
So I'm going to, nope. Did somebody say?
I did have a quick question. what's the definition of warm line?
Oh, okay, yeah, sorry, I should have explained that. So line is kind of, it's basically if you're not in crisis, but you need just, it's sort of like ongoing support. So if somebody was saying like, I want to hurt myself, you would not want to refer them to a warm line for support. You'd want to send them to our crisis center, which I'll be giving that at the end. That's on the last slide. But if somebody's just sort of saying, you know, I don't have a therapist or I don't have support, I just wish I had somebody to talk to. The warm line is a 24/7, anytime you want it, anytime you need it type of thing. So anybody can use it anytime.
So just a comment, I'm going to be giving this number out a lot.
Great, that's good to hear. Yeah, and a lot of people don't know that this exists. These warm lines that are 24/7 in California, they're pretty new. We've only had them really within the last year or two. Prior to that, there was nothing existing for like just anybody could call from anywhere. San Francisco area has had a warm line running for a few years, but I don't think that it wasn't really like a statewide thing. So it's good. It's exciting. We try to give it out. Well, I try to give it out as often as I can. So, okay. So private insurance is probably to me, it's more frustrating, and Lisa can jump in if she has other advice for you. Please, Lisa, interrupt me if I'm saying things wrong here with private insurance, but really, when it comes to private, if folks have private insurance, the best starting point is to look at who is in your insurance provider's network. Usually your contact phone number on the insurance card or at the website. I've been through this process myself. It's a little frustrating, you know, the provider, your insurance provider will have certain folks that they cover and certain folks that they don't. And really the only way to know that is to go to your insurance provider and find out who that is. Usually those provider network listings, sometimes they are not kept well up to date. You don't always know who's accepting new patients. You may have to consider going outside of your immediate area to get a provider that will that's willing to see you. So this is kind of, we don't at Sutter U, but we don't typically see a lot of folks with private insurance. We can see people with private insurance, but the client may wind up getting the bill for the services that they're receiving here because their insurance may not cover our providers in our clinic. So sometimes we are able to work that out where initially the insurance won't pay for our services and then later it will pay for our services. But if you're dealing with a client that has private insurance, I've always typically told them to encourage them to start with their insurance company first thing. So to make sure, so that way they don't wind up getting stuck with bills that they don't want to pay. All right, any questions about private insurance?
Mark, if I could just interject.
Yeah.
That the insurance and the financial piece, that's going to be the same whether it's the adult client on Dr. Mark's side or whether it's the youth client on our side as well.
All I could hear was like the host voice. I couldn't hear anything else.
I had a question too, really quick. If somebody with private insurance wanted to go to behavioral health, like is there a set pay for, because some of them would be willing to see a therapist for money. Is it just really expensive or is it comparable? So
Therapy is not cheap. Yeah, I mean, it can be expensive. We do offer a sliding fee. So if their insurance doesn't cover the cost of their services here, they will get a bill from us. I don't know what it is right now, the billed rate. It's per minute. It's like, you know, $2 or $3 something per minute dollars, you know, so it's not cheap.
okay.
And they will, so they can do that, but just depending on their income, the higher the income the person has, the higher their sliding fee scale will be. So they will get a ginormous bill if they have a fairly decent income and they have private insurance that doesn't reimburse us.
Because I've just noticed that people with private insurance are having a hard time finding providers, like you said, especially in the immediate area. So it may be
Yes.
worth it to them to even pay, by the time you pay for gas and all of that stuff, if it was comparable in, to that. So it's like,
Yeah,
got it.
and we've had people do that, right? We've had people who are willing to pay.
Could I jump
And-
in for a sec, Dr. Mark?
Go ahead. I'm sorry, what, Josh?
Yep. Yeah, this is Josh. Yeah, and I just wanted to mention, it doesn't, to respond to Jolie, it doesn't happen very often on the youth side, but once in a while, we do have a family that has private insurance and decides to move forward despite the cost. But it can definitely be, for a family that makes, $4,000 a month. I mean, you could be looking at, an $8,000 bill pretty easily. So just kind of looking at the sliding scale, just to kind of give you a ballpark feel. And once in a while, again, very rarely, we do have somebody that decides to move forward with that. And otherwise, we try and connect them to their provider, like Mark mentioned, and see if there's other services that we could link them to.
Yeah, and the thing to keep in mind too is that we still use the same treatment criteria here. So at Sutter Yuba, we provide specialty mental health services, which is focused on folks who have chronic and severe conditions. So even if the person is wanting to come here, if they're not qualifying for the services, meaning they don't meet those criteria for chronic and severe conditions, we may or may not treat them here. We may still refer them out elsewhere if they don't meet that. And I'll talk a little bit more about what that means, what those chronic and severe criteria are. I'll talk about that a little bit later, but yeah, if they meet the criteria and they have private insurance and they want to be seen here and they are okay with the sliding fee scale that we give them, then they can be seen here. Does that answer the question, Jolie?
And just to jump in with that, but with youth too, there's, we also take into consideration their developmental milestones and is their behavioral health condition preventing them from achieving the next behavioral health milestone? So are they at risk, or are they at risk because of their behavioral health condition? So it's a slightly more broad criteria for youth.
All right. Thank you, Josh. Now, Medicare. So Medicare, as I mentioned in the beginning, they do pay for mental health services. They tend to have a narrower range of services that they pay for. They do pay for, and again, Lisa, it's been a couple years since I've done this directly, so I don't know if I'm saying it exactly correctly, but providers can include, so you can get psychiatric care and therapy services. It has to be an LCSW or a PhD or PsyD or doctoral person. So they're kind of stringent on the requirements as far as licensure in order for them to pay for services. It can be hard to identify private practice providers in this area that accept Medicare. I don't know that we have a lot of success with that typically. So having secondary insurance like Medi-Cal can be helpful. The FQHCs in the area do accept Medicare, but again, they may have limitations with who can be seen. So if let's say you go to Peachtree Clinic and you want to see a therapist there, if that therapist is an LMFT, a licensed marriage family therapist, they might not be able to be seen if they only have Medicare by that person, because Medicare only will see LCSWs for therapy. So, or psychologists. So there's some limits there with Medicare, but we do accept Medicare here at Sutter Yuba Behavioral Health. But again, the person has to meet those same criteria. Any questions about Medicare? All right. Now let's talk about Medi-Cal, which is the most complicated and probably will take us the most amount of time. So, so to start with, this is about, 2013, I'm going to say 2014. The state came up with this kind of crazy split benefit thing where basically the way behavioral health services are doled out in the state of California, you have to basically determine whether that person is either mild to moderate or chronic and severe. If the person has mild to moderate symptoms and impairments, then the responsibility for payment for those services falls under the managed care plans. And on here, it's in our area, that's Anthem Blue Cross and California Health and Wellness are the two managed care plans. And a mild to moderate condition would be indicated by lower levels of impairments due to behavioral health conditions, or if they're used, as Josh or Darren shared, can be related to developmental milestones as well, or lower level of need for acute care. So we look at, is that person at risk of hospitalization or needing to use crisis services? And if they're not, then they tend to be more in the lower or towards the mild to moderate level. We don't expect people to determine it themselves, whether they're mild to moderate or chronic and severe. But it's good for you all to know that as folks helping people get services, so you kind of have the background and understand why it maybe looks different for different people. You can call the managed care plan. They can call the managed care plan directly, or they can go to directly to a clinic. So most of the clients you'll be working with are getting some kind of medical care from a service provider that takes Medi-Cal. So if they're going to Peachtree or Ampla or Harmony Health, they can go there and ask for behavioral health services. Typically, those the FQHCs, they typically require that if you're going to get your behavioral health services there, that you also, if you want behavioral health services, you have to also get your primary care at that clinic, is typically what they provide. And Lisa, jump in and correct me if I'm wrong. At least in the past, that's always been the case where, you have to kind of get those services hand in hand. You can't just show up there to get a therapist, but see a doctor at a different clinic for, your medications and things like that. So if you run across a person, they have Medi-Cal, they have Anthem Blue Cross as their Medi-Cal managed care plan, and you're fairly certain that they're probably in that mild to moderate shape, right? That they don't seem like they're having real chronic impairments and long, severe impact from their symptoms. This is probably the best way to steer them. Talk to their primary care provider, talk to their, start with the managed care plan, go to that network and see, see if they can find a provider that way. I did want to ask Lisa to jump in a little bit here to talk about, there's some other services that that managed care does offer. So if somebody has Anthem Blue Cross, for example, they can access telehealth very easily under Anthem Blue Cross. They have a system called Live Health Online, where you go online and you can set up fairly easily an appointment with a psychologist or psychiatrist for online health, and it's free for Anthem Blue Cross members, and it's fairly timely. Lisa, can you take a minute to talk a little bit more about some of the other resources that we had talked about?
Sure. Hi, everybody. This is Lisa from Behavioral Health. So basically with Live Health Online, it is actually very, very simple. It takes only a few minutes to walk people through the sign up process. And once they're connected, it's very easy to get an appointment. Most of the time you can get an appointment with a medical doctor within 15 minutes. You can get an appointment with a therapist. Right now it's about 2 days. And for psychiatry, it's usually the same day. So it's a really great resource. There's also Bright Heart Health, who takes all kinds of different insurance. They also take private. They take Medicare. They take both of our managed care plans. They're a bit more extensive when it comes to serving the client. So there's usually a team of members that are working with them. And that process is a little bit more in detail when you first call in. Their assessment usually takes about an hour and a half.
And Lisa, could you put in the chat when you're done talking, could you put in the chat the links for Live Health Online from Anthem and also the Bright Heart Health link
Sure, I can do that.
so that people have that?
Yes.
Could I add something, Mark? This is Cindy.
Yeah. You bet.
We have a iPad. We have the capacity out in the streets. The street nurse team from Adventist Health and Ride Out to provide this service. We actually have an iPad that Anthem has given us, so we are using this out in the street too.
Perfect. Awesome.
Yeah, I was just gonna say, Mark and Lisa and Cindy, thank you guys for sharing this information. This is Alicia with Anthem, and if there's any specific questions, I'm happy to answer those. But I can put that information in the chat box too, Lisa, for you. And we can share our flyers with everyone to see if that's helpful. But thank you guys for sharing this. I'm actually really excited to hear you guys talking about it.
Yeah, Alicia, I did not realize you were on the call, so hi.
No, it's okay. Hi, I was like, yay, clapping in the background, but I didn't want to interrupt you because you were doing such a good job. I'm like, we should just have you come present for us as well.
Thank you. I don't know if I'll take you up on that, but
You can think about it.
I'll think about it. Yeah, so Lisa, were you done? Was there anything else you wanted to share in terms of?
I think that's pretty much it for now. If anybody has any questions at the end that come up, certainly welcome to answer them. I think one of the most important things that you've already touched on is how difficult this process can be for most people. So a little bit of hand holding goes a long, long way.
Yeah. All right, so that's my little spiel on managed care. I'm going to talk a little bit now about, so on the other side of the benefit, so if folks have more chronic and severe conditions, typically that would be provided by the mental health plan, which in this county is Sutter-Yuba Behavioral Health, actually in both counties is Sutter-Yuba Behavioral Health. And we provide services, what we call specialty mental health services, which is really focused on those chronic and severe conditions. Those would be indicated by higher risk factors, dangerousness to self or others due to the behavioral health condition, inability to provide food, clothing, and shelter due to behavioral health condition, or if there's multiple life impairments such as a loss of job or inability to engage in self-care, or if the condition causes frequent use or risk of use of acute care services like psychiatric hospitals, crisis or emergency departments. We always start with a triage at behavioral health. So I guess this would be just true, universally true. Any person that you get that you're not really sure about, if you say, well, this person might be severe or they might be mild, I don't know, we don't really know what they are, you can always just send them to our open access clinic to be triaged, and the person doing the triage will kind of make that determination, right? They'll screen them to determine whether they need more specialty mental health services or mild to moderate level services. And we refer back and forth frequently. So Lisa, who's on the call, who was just talking, she's our healthcare access coordinator. And the bulk of her job involves helping people, once we triage them, if they don't qualify for our services, she helps connect them to whatever level of care that they need. And so she's very in tune with the resources in the community. And so even if we determine that somebody doesn't qualify for our services, we'll try and help them connect to a different service. And many times Lisa's able to get somebody an appointment that same day with a different resource. So I included our open access clinic flyer here. I also put it as an attachment in the chat. So if you wanted to, you can grab the attachment out of the chat and print that out for yourself and share that with clients if you want. There's both the Spanish and the English versions. This is just recently updated. And this includes the Latino Outreach Center, open access hours, and the drug and alcohol services. So we do our intake for drug and alcohol the same way with the open access walk-in model. And that's in the flyer as well.
Mark, could I just throw in there just one brief comment?
Go for it.
Alcohol services for youth are also accessed at that same location through adult outpatient. So those hours
Right.
are the same for youth, and they accept youth 12 and up.
Yeah, thank you. That's perfect. Yeah. So unlike so this flyer actually refers mostly to adult open access with the exception of drug and alcohol services for youth. If they're 12 and up, then they can be screened for drug and alcohol. Otherwise, the services on this flyer are 18 and up. Oh, I'm sorry, that's not true. At Latino Outreach Center, theirs is an all ages screening as well. So we should probably fix our flyer to be more clear about the ages on here, because this description here isn't quite exactly right. Anybody can attend the Latino Outreach Center open access, and anybody 12 and up can attend the drug and alcohol open access.
May I ask a question?
Yeah.
It says call in. Does that mean it's not open for drop-ins right now?
Yeah, sorry. So it's preferred that folks call in. You can walk in and request services if people who don't have a phone. We will see them live in person. But the preferred method currently is still call in.
Can I ask one more clarifying question really quick?
Okay.
So this is for the adult access, but any child 12 and up can go to the drug and alcohol and the other place. What did you say? I'm so sorry. I'm trying
Latino Outreach.
Latino Outreach.
Yeah, so Latino Outreach, this flyer does need to be better. I'm glad we're having this conversation, because every time I think this flyer is good, I realize there's something missing on it.
I think it's pretty solid, Mark. I mean, it's a good flyer. It's just there's a lot of nuance. That's the
Yeah. So so the Latino Outreach Center, I should say, is for all ages. So there's a no age limit on the Latino Outreach Center. It's youth. They all go to that one place. For drug and alcohol services, we don't have drug and alcohol services for youth under 12. From 12 and up, they would go to the open access clinic here at 1965 Live Oak. And then for the mental health services, that's 18 and up. So yeah, I don't know. Does that clarify, Jolie?
Yeah, so you guys are not at Veterans Memorial Circle anymore for the youth?
We are. So they have their own separate for youth mental health services, non-Latino.
Okay.
Own clinic. And,
Got it.
And I'm
Okay.
assuming, Josh, do you have a flyer for your open access?
yeah. Darren and I have a flyer for the youth open access, so we'll make sure to put that up as we move forward, and additional information for accessing services with youth. It's kind of weird how there's a little overlap, so it can be confusing, but there really is, I mean, no wrong door. I mean, they'll point you in the right direction. If you call into one area, they'll direct you to the other area. They're not going to turn you away.
Well, I make little business cards for the mental health stuff that we give our families. So I want to make sure it's updated. Okay.
Yeah, if you call the main desk here, they'll direct you to the main desk at the other clinic. So
Okay. Thank you.
I lost my page.
Sorry. Made you
There we
lose your
go.
page.
That's right. I accidentally clicked the scroll button. All right. Any other questions about open access or the way the process works? All right. I'm going to talk for just a minute about substance abuse services. I don't want to spend too much time just because I want to make sure Josh and Darren, I've already kind of taken a lot of time and we want to have time for questions at the end. So I'll do a quick overview of substance use services. So really what we're trying to screen for when people come in is, do they need outpatient or inpatient residential services? Private insurance usually cover substance use disorder services. So people, again, if they have private insurance, they should probably start with their insurance provider to determine what services are covered and where they can get their treatment. If they have Medi-Cal, then they are eligible for drug Medi-Cal services. The services covered under drug Medi-Cal include outpatient and intensive outpatient group treatment, narcotic treatment programs, and perinatal residential treatment, and also a treatment program called naltrexone, which is a substance use medication-assisted treatment. Really, the best way to steer folks if they're needing substance use services and they're in the indigent population is to just have them come here to open access and get screened at Sutter Yuba for treatment, and we can make recommendations from here. the downside to our current drug Medi-Cal process is that we sometimes don't have enough funds. We have to use our own funds for residential treatment services for non-perinatal. So a lot of times we get frustration for residential treatment when that's the appropriate level of care. But it starts with a screening process that happens here in open access. There's also lots of community providers. So there's Pathways here in town. There's Aegis and other places that provide medication assisted treatment. And also all the FQHCs now are providing some medication assisted treatment as well. So anybody can go to their treatment provider if they're needing, you know, if you have folks that are having issues with medication, prescription medication addictions, you know, opiate use, opiate addiction, they can go to their FQHC providers and ask for some assistance with that. So that's what I'll say about substance use. Any questions about substance use before I wrap up and turn it over?
Hey, really quick, Mark, just wanted to let everyone know that Bright Heart has that resource as well for substance.
Okay, good to know. I did not know that.
I have a question for
And
Mark.
that link you're putting in the chat, right, Lisa? For Bright Heart?
Yes, I put it in the chat already.
Okay, cool. And then just some final thoughts. Of course, always, if it's an emergency, please refer folks to crisis. 673-TALK is the 24-hour number. We have crisis staff at Adventist Rideout Emergency Department 24/7. We also have psychiatric emergency services here at 1965 Live Oak from 7 a.m. to 11 p.m. That's 7 days a week. So people can walk in and just talk to a crisis counselor here without having to go through the ED process, which is nice. So people who are put on holds are brought, if they're put on a 5150 hold, then they're taken to the emergency department, but they can come here voluntarily anytime during those business hours. So before I turn it over to Darren and Josh, any questions for me about adult services or access?
I have a question for you, Mark. Do you have anything to add about dual diagnosis clients?
Yes, so we're still trying. We had a fairly strong dual diagnosis program going for a while. Kind of got a little bit injured when probation stole one of our dual diagnosis people, but we're trying to rebuild that right now. We offered some dual diagnosis services here at Sutter Yuba. And I don't know the extent to which the FQHCs offer effective dual diagnosis services. That's actually a good find out question. I don't know if they offer a lot of services specifically tailored to dual diagnosis, but we do offer some of those services here, and people who are go through open access can request both substance use and mental health services. And I mean, here at Behavioral Health at Sutter Yuba, our programs are integrated anyways. You know, our therapists and our drug and alcohol program work kind of hand in hand. And our Options for Change program has 2 therapists in it working in the program. So those therapists can provide the dual diagnosis treatment within the program.
I have a question for crisis. Does it matter what your insurance is for crisis, or you serve everybody and figure it out later, or how does that work?
It's the same. So I'm not sure if they bill on the first visit or not, but yeah, crisis services are billed for. But when the person first shows up, they will gather financial information from them about their insurance. And I'm not sure, actually, that's a good question. I don't know for sure if they, what they do about billing for services if somebody's brought to crisis like involuntarily, because I don't think they can bill somebody for a service that they didn't want to get. That's a good question. But we do bill for crisis intervention to the insurance if people have it.
Mark, I have a question. I don't know if you can answer it or not, but when I send somebody to open access, and my ultimate goal in most cases is to get these people on meds because they either previously were and they've fallen off, or they're new clients to us and they really need, they have a severe mental illness and really need meds. What's our timeline from the time I send someone to open access to where they can actually see a psychiatrist and get some medications for their illness?
What I was told, I asked about a week ago, it was last week. Our wait times are about within the area of about 2 weeks right now for psychiatrists. So from the time that they're intaked. So that's assuming that the person, so basically the way the process works is the person gets signed up for open access, and then usually that day or the next day, or within 2 or 3 days, if the person is not difficult to reach by phone, the open access staff are getting on the phone and they're calling and they're doing phone triages to triage somebody. If that person is eligible for services and they get their intake completed, then once the intake is completed, then the therapist will set them up with a psychiatrist. And the wait at that point is we're at about 2 weeks right now. Our goal is 10 days, and some people are getting seen within 10 days, but other people are not.
Okay, thank you.
But
Yeah,
we're actually doing, to be honest with you, so here at Sutter Yuba, we're doing really well with psychiatrists right now and less well with therapists. So it's we do have a wait list for therapy right now. So it's going to be longer to see a therapist than it will be to see a psychiatrist, which is very unusual for us. You didn't used to be like that here, but for a lot of different reasons, we have a therapist shortage in this area. So.
okay, thank you.
Yep.
So I wanted to say thank you, Dr. Mark. That was a great presentation. So we have about 10 minutes left of our convening today. And I wanted to see, do we think we have enough time to do Darren's part of the presentation? I'm always happy to invite you guys back.
Darren, what's your thought?
You did such a great job with the foundation covering of it that I think Josh and I can fit it in with the 10. And
Okay, let's do it.
I'm trying to download our triage schedule, but it's telling me my network is down. So I might email that out to Jason, and he can filter it out. So I don't have a fancy PowerPoint project that Dr. Mark had, but we also begin every youth service with our triage process. And we have a hybrid of both phone call in and walk in. And so we have our triages on Mondays and Thursdays. And the number to call is our regular youth outpatient number at 822-7513. And at that point, our business office will take the demographic information, the financial information. And so they will know what the cost is if there is a share cost prior to any service being done. That phone call triage or in-person triage is then completed. And at that point, it's determined what level of service is best needed. And so just like the adults, if it's mild to moderate, then we refer them to the mental health plan, the FQHCs. If they're more the severe, and like Josh pointed out, if there's developmental issues, then we would accept them here in our youth outpatient services. And we have individual therapy, recreational therapy group, family therapy, and medication support. If they need higher level of care than our youth outpatient, then we refer them to either our community-based services, that's either done by Josh's team over at Children's System of Care, or our contract provider, Youth for Change. And they both do our community-based services as well as our full service partnerships. And so I'll let Josh take over with the community-based services and the TAVE full service partnerships.
Right. Sounds like a plan. I just wanted to also point you guys to the chat. We entered just kind of information there. What, you know, the youth services open access information is there. Darren's going to send the flyer as well, as he mentioned, but there's a variety of resources that are there in the chat. And I'll go ahead and share my screen real quick if I can. And it has that same information. I'm hoping this is it. Can you all see that? Are you, yes, okay. So first off, there's the California Parent and Youth Helpline. And so these are in order of maybe kind of more intensive access to less intensive, moving down to more intensive or more immediate needs. So, you know, in general, there's a California Parent Youth Helpline and the numbers available there. It's only available 8 a.m. to 8 p.m. Monday through Saturday. There is also for current and former foster youth, there is the Family Urgent Response Services, which is a statewide hotline to help preserve the placement and support the caregiver. So that's available as well. And then moving on down beyond that, there's the Youth Behavioral Health Services, which Darren mentioned, the open access clinic. Like you mentioned, the preference is to generally call first and then set up an appointment with the caregiver at 822-7513, Monday through Friday, 8 a.m. to 5 p.m. That's right, Darren, the hours.
That's the hours are open. That's not the hours of triage though.
Yeah, but that's the hours that they could call to set up a triage appointment, right?
Correct.
Okay, okay. Perfect. And then there's also, as we mentioned earlier, substance use disorder services. Now, for those services, you want to go through the adult open access clinic, and you can call 822-7200 Monday through Friday, 8 to 5, I believe, right, Mark? It's when the phones are open?
Yes.
Yeah. Okay, thanks. And then, of course, I just listed adult services because sometimes parents need support too. So, but Mark already thoroughly spoke to those services. And then, of course, there's psychiatric emergency services, which Mark also spoke about, and those are available 24/7. So, Darren's shop over there at Youth Services at 1445 Veterans Memorial Circle. That is the portal to entry to services that I oversee with the Children's Systems of Care, the more intensive services, and our full service partnership, and also Youth for Change. So that's the place to start for somebody in the community. Just call that number and get assessed. And they'll be assessed. If they meet that level of care, then they'll be referred up to those services that are available, Children's Systems of Care or full service partnership or other community-based services to help support the function of that client and family. So I think that's, Darren, is there anything that
What additional services are offered through CBS and FSP that we don't do at Youth Outpatient?
Sure, thank you. So the community-based services that are provided through Children's Systems of Care and Youth for Change, the clinicians and case managers can work with the family out in the home or sometimes in a non-traditional service location. During COVID, we've been providing services, face-to-face services with distancing outside, like on the porch, you know, backyard, anywhere where we have a confidential enough space. Sometimes park bench works. So we can kind of get out of the office a little more with the community-based services, which is helpful. We also, again, there's, you know, case management services that are provided. We work in tandem with the psychiatrists as well. Both in youth and adult. Our full service partnership serves 16 through 25-year-olds and through Children's Systems of Care. And then with Youth for Change, they serve 15 and under through a full service partnership. And with that, the full service partnership, you get a team. So you get not only psychiatric if needed, but you get therapists, intervention counselors, peer staff. We have peers available, and we really try to focus on meeting the client where they're at and client centered services. And again, we want to overcome whatever barriers there are. So there's access to some flex funding as well. So if there's some issue that's exacerbating the child's behavioral health, Sometimes we can eliminate that issue if it's, say, car registrations causing, they're not able to pay that, and that's causing a lot of stress to the parents struggling with their parenting skills and providing support to the youth who's struggling with their behavioral health. And sometimes we can eliminate that barrier for them. And it's a team environment, and it's a partnership is the way that we kind of look at it. So there's intensive services. We do child and family team meetings, especially for our foster youth. That's a big area of focus that we want to make sure to make team decisions and partner around everybody's strengths, and have clear communication around that. So a lot of CFTs happen in those community-based organizations through Youth for Change in Children's Systems of Care and our full service partnerships as well.
And the youth triage folder or flyer actually was, it worked in the network, so it's in the chat.
And yeah, and I'll say, I think I just shared the PowerPoint. I was having trouble getting the PowerPoint to share. It was not wanting to, but I think is it there now? Can you guys see it in the chat?
Yes, it appears to be there. Yeah.
Okay, good. Yeah, it wasn't telling me network connection issue, but now it looks like it should be there for you all. So you have the copy of my PowerPoint. You have the other stuff that Darren and Josh were sharing, and I did share earlier on in the chat some of those flyers that were shared earlier. So,
Well, thank you so much for your presentation. This was a lot of good information. We are coming up to time. I have one last thing I want to share with the group. I'm going to be launching a poll, and I would like you to please vote. We're looking at what we would like to do for our June 23rd convening. Specifically, we would like to talk about substance use programs. However, there's so many. We would definitely like to get your input on what type of program you're hoping to see and hear about. So if you could please vote. I want to thank everyone for joining us. I want to thank Sutter Yuba Behavioral Health for your presentation. That was a lot of great information. We will be sharing all the documents with the stakeholder group to ensure everyone gets them. And our next meeting is June 23rd from 12:30 to 1:30. And I hope everyone has a great 3-day weekend.
Thank you for the opportunity to share.
Thank you so much.
thanks.